My name is Richard Huff. I come from Newbury. I live in Newbury. I am semi-retired at this point in time, looking for work but not urgently, if that makes sense. I was given life-saving care here in December of 2017. After that point I decided to volunteer to the hospital to give something back, which I guess is the usual answer you get to this sort of question. I was just doing some work with the intensive care unit, and then of course in January of this year, when things started ramping up with the arrival of coronavirus in the UK, I was contacted by the volunteer services initially to ask if I could go and pick up some CPAP machines from people in the community who were using them, either didn't use them anymore or didn't think they required them anymore, and returning them to the hospital for use there. And then I started doing what they call the blood running, which is taking the swabs and the blood samples from the A&E unit to the pathology lab. Currently I do Thursdays 10 till 1 every Thursday, and the volunteer services are aware that I'm available at any time, so they just call up and call me in when they need me, but the regular is 10 till 1 o'clock on a Thursday. An average shift of blood running is collecting the samples, be they swabs or bloods. They are delivered in about a 100-metre walk to the pathology lab, and then I come back. That takes about 3 minutes, and then just wait for the next batch. Every one of them says thank you. Everyone has a bit of a laugh with you, and they're also very grateful, which is astonishing considering what we're doing, I think, is not really much in balance with what they're doing, which is quite intense and in many ways quite dangerous. I have done other little things, delivering equipment to West Berkshire Hospital, donations that were given to the Royal Berks, but Royal Berks wanted to spread it out to other hospitals in the area. So I've dropped off Easter eggs, teddy bears. I've collected scrubs bags as well and delivered to the hospital. So it is quite varied, but it comes and goes. It's quite interesting because it's varied. I can understand why a lot of people are avoiding hospitals, because they probably consider them as a big two-storey petri dish, I guess. But I'm not that risk averse, and I don't know whether that's a good thing or a bad thing. I am well isolated at home. I come here in my own car, so I'm not sharing public transport with other people. The waiting room, which is where we sit when we're not actually doing the blood running, is you sat there on your own. You're delivering to the path lab. The journey to it is mostly in open air, so the risk of contracting or infecting other people is in fact very small, and I think on balance it's the best thing to come and do something if you can, with very little risk. What I get from volunteering is a sense of feeling good about myself, that I'm doing this to help other people without being financially rewarded. I do get a reward knowing that I'm doing it. I do get a reward having fun and meeting new people. If anybody is thinking of volunteering, I would thoroughly encourage them to do it. It would make them feel, give them a greater sense of self-worth as well. It's a big help for the hospital, I know that, because they do keep telling us that any volunteers that come in is of enormous help. It's quite fun, and you're working with a lot of very talented, very lovely people.
My name's Alison Eatwell and I'm lead nurse for the emergency department. So before the volunteers and before pre-COVID, as we call it affectionately now, we used to use our pod system to run all our bloods and our swabs. Since COVID, unfortunately we can't send the bloods down the pod system, so we've had to get who's available, so the porters, the nurses, whoever was able to do it would run the bloods down. So it was a delay basically getting the bloods to the lab, which took longer for the results to come back to us. With the volunteers, it means that we've been able to get the bloods every 15 minutes down to the lab, which means the turnaround for blood results is a lot quicker, improves the patient experience, so it means the patients are here for a shorter period of time, either being then directly discharged home or then being admitted to hospital. They have been fantastic. We love the volunteers. Thank you so much for all your work. It's really appreciated. Thank you.